Hi, and welcome to Your Wellness Minute. I'm Lisa Lounsbury, and I'm here with my guests, Jean and Dave. And we just finished talking about the benefits of sleep, the importance of sleep, and sleep apnea specifically. You're a patient with sleep apnea, and you're a respiratory therapist, and you're also an expert as well. And we've been talking about some different equipment. So let's just talk a little bit more about sleep apnea, and what exactly does a CPAP machine do to help you? So how do we get started on this journey of diagnosing sleep apnea?
So when somebody suspects that they may have sleep apnea, or they just go see their physician because they have no energy and they're tired most of the day and not waking up refreshed, physician may forward them to request a referral to a sleep lab, and then the sleep lab, once the patient goes in there for their appointment, they are completely hooked up with some electrodes on the head and on the face and legs, abdomen, and chest. Mm-hmm. And all of these electrodes give information to the technician to help diagnose any type of sleep disorder, for that matter. But what we're talking about here is obstructive sleep apnea.
Right.
Once they're diagnosed with sleep apnea, then they usually get referred to a home care company to get set up on usually a trial period of the CPAP, and a lot of that is to determine the exact pressure that's required, and also figure out what type of interface they need.
Now, Dave, you actually wear one of these at night, mm-hmm. and you were just telling us how beneficial it is for you. So can you explain how yours works and what's it actually doing while you're sleeping?
All right, so what you have is you have a mask that goes over your face, and it creates a seal, and really what you're doing is you're blowing air into your airway. If you think of your airways as when your airway collapses down, this pressure holds it open. It's like you have a balloon that's deflated, you blow air into it, holds it up, right? And so that air, the air that's coming from the machine on the mask is, it's being directed into your airway, creating that pressure, and so your airway is no longer closing on itself anymore. Okay. And that exact pressure is a prescription. There's a different number for every person, how much pressure you require. You want to give someone the minimum pressure required to hold their airway open, and that's something that some of our machines actually determine.
Okay, so it's not a cookie cutter kind of recipe for everybody.
No.
It's all unique.
Yeah.
And how long have you been wearing this?
I think about 2 years now or so. A couple of years, yeah.
And so you're seeing a significant improvement into your
Absolutely.
energy.
Yeah, I will not go without it if I can avoid it at all. So, yeah.
Very cool. Do you see any other innovative products that are supporting sleep apnea other than the ones that we have here today? Are they coming out with some different styles or?
There are other alternatives to CPAP. One of them is a mandibular device, so usually it would be something that a dentist would set up in your mouth, a custom fit
right. I've
mouth.
actually seen those, yeah.
That brings the
jaw
mandible forward.
Very cool.
You have to be diagnosed, I think, to not have sleep apnea, but you're more treating the snoring part. Okay. So there's snoring that happens, and then if the worst part is when there is no snoring and there's a stoppage of breathing. That's sleep apnea. That's
dangerous, right?
Yeah. So if you're treating just snoring, then it's possible that they can use the device or mild sleep apnea.
Okay, so there is a difference there. So we have to make sure we understand that. Well, this is a fascinating topic because I know so many people are suffering from lack of sleep, and hopefully this will inspire them to seek out some medical advice and get a good night's sleep. So I'm getting very sleepy. Good night, everybody.